All right, so we have a 50-year-old woman who presents to the emergency department following a syncopal episode. On physical exam, she is diaphoretic, she's alert and oriented. Her blood pressure is 95 over 50, and respirations are 12 per minute. Her rhythm strip is shown above. What is the most appropriate pharmacological treatment for this patient's condition? This is a rather straightforward question, and for an exam, this should be relatively easy. This question will get those that sometimes overthink board exam questions a little tripped up, but given what these answer choices are, which I'll read in a moment, this should be pretty straightforward here. Let's take a look at this. The rhythm strip shows a rhythm that has a P, a QRS, and a T. The QRS is narrow complex, and it is slow. It is a generously slow rhythm, so we have a sinus bradycardia here. And the reveal for this question, the takeaway here in the question is that she is currently diaphoretic. That's very important. And then you look at her blood pressure, it's 95 over 50. And she just had a syncopal event. So you put these together with a rhythm strip that shows sinus bradycardia, and that will dictate her treatment. Now, let's go through the answer choices, and you'll see how sometimes some people may overthink this or get led down the wrong path, but ultimately, I think everyone should get this question correct. So, answer choice A, adenosine, B, amiodarone, C, amlodipine, D, atropine. So, a lot of A's here, a lot of enes. So, as long as you're going slowly, you should get this one correct. So, let's start with answer choice A, adenosine. Adenosine, AV nodal blocker, used in supraventricular tachycardias, not the right drug for this patient who has a bradycardia. So let's cross out answer choice A. B, amiodarone, antidysrhythmic. It's mainly commonly used in ventricular tachycardia. So not going to be given to a patient with sinus bradycardia. Now we have C, amlodipine, a calcium channel blocker, a dihydropyridine. This will affect the AV node. It will vasodilate, will lower blood pressure and lower heart rate. So, not the drug for this patient. Okay, then we have D, atropine. Atropine will inhibit some of the vagal tone, hopefully increase the heart rate. And atropine is the drug of choice for bradycardia. Now, here's what the astute clinicians are probably thinking in a case like this. What is causing the underlying sinus bradycardia here? Given that this is a 50-year-old woman in the clinical setting, my guess would be she's either having an ischemic event, but more likely she probably took a little too much of her beta blocker. So my thought is this is probably a patient who will have a beta blocker overdose. However, that's my clinical mind thinking. There's nothing in this question that refers to beta blockers, that alludes to beta blockers, that even asks you to address anything specifically about beta blockers. So here's a very important test taking strategy that when you have a question, you just have to answer the question for what it's asking and the information it has given you. So the question only wants to know what is the treatment for this rhythm, sinus bradycardia, given the 4 answer choices here. And of these 4, atropine is going to be the correct answer. So let's click D, make sure we are correct. And sure enough, atropine is the correct answer. Hey everyone, before you go, if you're interested in your own QBank, whether you are an MD or DO, a PA, or an MP, simply go to roshreview.com and sign up for a free trial. See if Rosh Review's content is right for you. Keep learning, keep working hard, and always have a sense of mission about your work. Now is your time. This is Dr. Adam Rosh signing off.